Hello friends, I am Dr. Disha Sonarkhanova. I am consultant at Marvel Skin Hair and Laser Clinic at Latur, Maharashtra. Friends, summer season is going on. So today in this video we will talk about common conditions seen in summer season, that is miliria. Miliria is commonly called as prickly heat rash or sweat rash. In this condition, there are tiny droplets of fluid-filled rash seen mostly in those who sweat more than usual. This condition is seen in hot and humid climate. This condition is caused by blockage of sweat glands, that is eccrine sweat glands. As the sweat ducts get blocked, the sweat does not flow to the surface of the skin, that is in the upper layer of the skin, in the epidermis or in the dermis, and it flows in the reverse direction due to blockage. As a result of this, the sweat starts seeping into the epidermis or dermis, and depending upon the level of the block of sweat duct, there are different types of miliria. Let's see what are the causes of blockage of these sweat ducts. Usually this is seen in hot and humid climate when people perspire more or there is a lot of sweating. In normal temperature also, if the sweating is absent, then this condition can be seen. In neonates or infants, as they don't have more developed sweat glands or sweat ducts, as a result of this they do not produce more sweat, and generally this heat rash is seen on neck, shoulders and chest of newborn babies. Similarly, in adults, it is seen in those areas where there is contact of that is tight clothing. It can develop at any age, but it is more common in neonates because they don't have fully developed sweat glands and sweat ducts. It is more commonly seen in tropical climate, in hot and humid climate, along the sea, those living along the seashore because there is humid climate. It can also be seen in normal temperature in those people who don't sweat. Also, it is seen in bedridden patients who are lying in the same position. Let's see what are the types of heat rashes. First is the Miliria crystallina, in which the crystal clear fluid filled vesicles or fluid filled pockets are seen on the affected area, mostly on the back. In children, it can be seen in the elbow creases, or in the affected area is the neck, chest and shoulders also. Third type is the Miliria profunda, which is seen in people who get affected by Miliria rubra often. This is most commonly seen in military personnel who are posted in tropical climate. Now let's see what are the symptoms of heat rash. First is the burning sensation or prickly heat sensation, slight itching, slight pain, and this itching worsens on sweating. There is appearance of a rash, fluid filled vesicles, which may be clear fluid or reddish, or sometimes may be pus filled. If there is secondary infection by Staphylococcus epidermidis, normally this Staphylococcus epidermidis is a commensal or normally present on the skin, but sometimes collection, oily secretion along with sweat, it may block the sweat duct. Then the factors which predispose to this miliria are having physical strenuous activity in summer season. The factors which aggravate these heat rashes includes in females menstrual flow due to hormonal imbalance. Secondly, development of friction between the clothing and the skin. So the precautions which we should take is first we should wear light clothing and loose clothing, cotton clothing, which will allow air to pass between our clothing and skin, and definitely it will not allow accumulation of sweat. We should take bath twice daily in summer season, and we should take bath with cold water or normal temperature water and cold shower, and we can if the area is affected, we can apply ice packs also. We should avoid applying mineral means we should avoid applying creams which contain mineral oil or petroleum jelly, because this can further block the sweat gland. We should use AC or fans or coolers during summer season. This condition is most commonly seen in rural people, where there is electricity goes in the afternoon and there are no coolers, ACs. The precautions we should take are: we should avoid strenuous exercise during summer season, we should stay hydrated, we should drink lots of water, and we should wear cotton loose clothing. So I hope you find this video useful in this summer season, and if you like this video, share this video. Thank you.